Hi, everyone. Buenas tardes a todos. Good afternoon. Welcome to the 5th day of the Latino Health Forum. My name is Elliot Enriquez, and I will be your host for today. First and foremost, I want to thank these wonderful and amazing sponsors that you see on the screen. A big shout out to Sutter Health, the Healthcare Foundation of Northern Sonoma County, the Sutter Santa Rosa Family Medicine Residency Program, the Press Democrat, St. Joseph, Kaiser Permanente, and the Sonoma County Department of Health Services. So, as all of you know, that you are logged on, you've been able to participate and log on and hear all of these wonderful speakers free of charge this year. And we could not have done it without the support of these amazing and ongoing sponsors. So once again, thank you, thank you, thank you. Today, we're actually going to be talking about the disparities that are affecting Latinx essential workers. And with us, we actually have two of the busiest and probably biggest advocates for this community in Sonoma County. So first, you're going to hear from Gabriel Machabanski, who works for the Graton Day Labor Center. Gabriel is originally from Chicago. He's a child of immigrants. He is committed to combating structural racism and supporting people of color and immigrants building power. He has an MA in urban planning. He's new to Sonoma County, but he's also convinced that Northern California is the antidote to his nomadic lifestyle. Second, you'll be hearing from Fernando Torres. Fernando works for the California Rural Legal Assistance Program. Fernando has a background in insurance, health benefits, and marketing. As a community worker for CRLA, Fernando's duties include outreach, education, and helping community members under the guidance of attorneys with their legal issues, including housing, employment, education, LGBTQ, and civil rights, among other issues. Fernando was born and raised in Bogota, Colombia. He's fully bilingual in English and Spanish, and presently resides in Sonoma County with his wife and 2 children. So, wonderful speakers that we have ready for you today. I'm going to hand the mic on over to them. Once we do, please keep track of your questions, submit them online, and then after they're done with their presentations, we'll be able to answer them for you. I also want to give a big shout out to our 2 wonderful coordinators who are here with us today, which is Daisy and Pam. I'm actually just a face here talking to you guys, and they're actually coordinating and doing everything behind the scenes. So a big shout out to them, and also to the rest of the Latino Health Forum board. So I'm going to hand this on over to Gabriel. Gabriel, thank you so much for being with us today, and I'm going to hand the mic off to you.
Thank you, Elliot, for the intro. I'm just going to go ahead and jump right in. I'm going to share with you some information about our organization, the population we work with, the major issues that this community is facing, and how COVID-19 is both impacting their health and well-being and eliciting a proactive response rooted in their dignity as immigrant workers. Centro Laboral de Graton is a nonprofit organization that centers worker dignity, this through a process of developing worker leadership while raising labor standards. We have some core values and principles which drive our work, which you can see hashed out here. So day labor organizing began in Graton in 2001, when volunteers began working with and supporting day laborers at the street corner hiring site who were experiencing abusive contractors, suppressed and stolen wages, and unsafe working conditions, among other obstacles. Workers, organizers, and other community stakeholders came together to engage in a consensus building process to provide support and structure for the worker community there. And after several years, the physical site of the Day Labor Center came to be. Centro Laboral opened its doors in 2007 and has been a hiring site with programming and services for low-wage immigrant workers ever since. Next slide. So our members are overwhelmingly immigrant workers, hardworking folks who have acquired many skills over time as a survival tactic. They self-identify as day laborers and domestic workers, as those are the jobs that are offered through our hiring hall, from yard work and gardening to construction, moving jobs, house cleaning, etc. Our membership numbers over 500 workers, with about half that number active members who use the center's job dispatch program to find labor throughout the year. Many of our members are actually domestic workers and agricultural workers, depending on the season. Others are caregivers and gardeners, or construction workers and landscapers, and even restaurant workers. The beauty of the center is really that it is democratically run. We have a weekly Asamblea General, where all of our members participate and have a voice. We discuss jobs and wages, campaigns we're engaging in, and other pressing or relevant business. We also really hammer home workers' rights, particularly wage and hour law that stipulates overtime, meal and rest breaks, minimum wage, and other labor standards that allow workers to advocate for themselves on the job. We also offer extensive health and safety trainings on subjects from job site hazard identification to proper usage of PPE, ladder safety, use of power tools, and other subjects relevant to the work that they do. Worker centers like Centro Laboral have sprouted up over the last 2 decades throughout the country, often in similar circumstances, where street corners were not only hotspots for labor abuses, but also targets for criminalization by police, ICE raids, and anti-immigrant action from white nationalists and other xenophobic groups. Many are part of the National Day Labor Organizing Network and employ a similar member-led model where the day laborers and domestic workers are themselves agents of change and self-govern the organization. Now I'm going to pass the baton to Fernando to share a little bit with you about what CRLA does. Next slide.
Thank you, Gabriel, and thank you, Elliot, for the introduction, and good afternoon to everyone. My name is Fernando Torres again. I'm a community worker with California Rural Legal Assistance. At CRLA, our mission is to fight for justice and the rights of those individuals that are most exploited in our communities. This includes low-income individuals living in both rural and not so rural areas such as Santa Rosa, for example. It also includes our farm workers, of course, folks with disabilities, immigrants, parents and their school children, the LGBTQ population, seniors, and folks with limited proficiency in the English language, among others. Next slide, please. And we also at CRLA have been providing free legal services since the 60s, really, 1966. All the way from when those 2 individuals on your picture were an abortive supervisor, Ms. Dolores Huerta and Cesar Chavez. And from there, we have expanded services to, of course, include civil rights, all aspects of employment law, including wage and hour issues, discrimination, sexual harassment, among others. Fair employment and also fair housing in defense of protected classes, including discrimination against folks in regards to their age, sex, nationality, origin, folks with disabilities, among other protected classes. We also help folks with other housing issues, and we provide tenant defense, rights of renters, mobile homeowners, security deposit return issues, among others. We also assist folks with issues that relate to their public benefits, medical coverage, IHSS, among others. For education, we help parents to know their rights and how to avoid discrimination or discipline issues in their school setting. And we also inform community members of their rights to healthcare and issues related to this very important safety net. And we have a few medical legal partnerships through California, including one near us with the West County Medical Center, where one of our attorneys provides free legal advice on the topics I previously mentioned to those that attend the health center. Next slide, please. We also have special programs and initiatives. They're designed to protect against discrimination and abuse. We have a dedicated indigenous program that deals with matters specific to the indigenous population. This ranges from language rights to discrimination issues, abuse. We also have a separate LGBTQ program that equally addresses similar needs in the community. And we're always looking for systemic issues that may affect our community as a whole. As an example, here we see our educational campaign called No Más, No More, which focuses on the prevention of sexual harassment and assault at the workplace. We also have and continue to do training regarding heat stress, especially for our farm workers, educating them on heat how this may kill a worker, and what signs to look for to save those lives. We at CRLA try to utilize our resources to focus on efforts that will address systemic issues, as I mentioned, to benefit large numbers of individuals, but we, of course, assist individuals on a daily basis with their legal needs. And now I'm going to pass the microphone back to Gabriel, who's going to share information about the community members at his center and the issues that these folks are facing at the Graton Day Labor Center. Next slide, please.
Thanks, Fernando. Okay, so I want to provide a little more background about day laborers and domestic workers. The vast majority are undocumented, have always been highly vulnerable to health risks and exploitation that really relegates their lives and their bodies second to productivity and profit. Day labor is temporary, it's casual and precarious. So while day laborers may not be working in industries we consider, quote, essential, always, the urgency and need that our community has been experiencing since March often has forced them into high-risk scenarios for a day's pay. So who and what are day laborers? The phenomenon of compañeros, men standing around on street corners, some of you may be more familiar with these corners than others, began in the late 90s when many campesinos or farmers from Mexico were forced to migrate due to the socioeconomic impacts of NAFTA. Hiring sites sprouted up outside of hardware chains, gas stations, and other geographically specific landmarks, and contractors hired undocumented workers for all kinds of labor, from construction to landscaping and yard work and all the other jobs that I previously named. The idea of a day's work for a day's pay has been a way for many new immigrants or seasonally employed workers to subsist when needed. And this has met the demand of employers, generally contractors and homeowners, who are looking to circumvent high labor costs while getting good, hardworking laborers. This, however, has created an entire industry where workers are highly exposed to nefarious employers, often exploited, and then silenced by the prospect or even the direct threat of retaliation. The formation of centers for and by day laborers has been a powerful tool to combat this exploitation, not to mention the stigmatization of the guys on the corners. That being said, we at Centro Laboral fervently defend the right of any day laborer to seek work however they best see fit and not to be criminalized or exploited because their hiring site is a street corner. Next slide, please. Now, a bit on the domestic workers. Domestic work is used to describe a slew of professions that require taking care of individuals' private homes and lives. House cleaning, home care, which includes child care and elderly care, and so forth. The Day Labor Center houses ALMAS, which stands for Alianza de Mujeres Activas y Solidarias, or Women's Action and Solidarity Alliance. They are mostly domestic workers with some female day laborers mixed in, and they're a critical part of the work we do at the Day Labor Center, particularly in terms of the leadership and the political power that they hold. Domestic work is a vocation that has always been largely invisibilized. Throughout most of the 20th century, the domestic workforce was composed of largely Black caregivers and housekeepers and nannies. Now many more immigrants, including Mexicanos, Central and South American, Jamaican, Haitian, folks from other Caribbean nations, the Philippines, West Africa, Eastern Europe, the list goes on. For as long as domestic workers have worked in people's homes, though, they have had little to no protections as it relates to their wages, their treatment, and their health and safety. I also just want to take a quick minute to reframe something I mentioned in the previous slide. Although low-wage undocumented workers may in some cases be considered frontline or essential, they're always immensely vulnerable and experience high levels of exposure to COVID-19, regardless of whether they're essential. The financial hardship they've always experienced has only been exacerbated because work is slowed down and or stopped and they have no access to a safety net. They've been put in a position where they must choose between going to clean a stranger's home in an enclosed space for the sake of theirs and their family's economic well-being, or choosing their safety and staying home, which, as we know, The latter is a luxury only afforded to those of us with access to remote work options, unemployment insurance, and other benefits. In other words, a safety net. Next slide, please. Now, I'd like to look at the political and social environment in which low-wage undocumented workers have been working and attempting to survive and thrive throughout the pandemic. Centro Laboral's board president, Jesus Guzman, details in his 2016 report, The State of Working Sonoma, the chronic racial and socioeconomic inequalities that are persistent in Sonoma County, which are further exacerbated in times of crisis. So to name a few of the most critical systemic inequities that our low-wage immigrant worker community was coping with going into this pandemic, some of these I've already touched on. As everyone who's participating in this, I imagine, is most familiar with, low-wage Latinx workers have far less access to health insurance and to medical providers than those who had jobs which allowed them to easily transition to a work-from-home arrangement. We exist in and reproduce an inequitable system when those with higher health risks in the workplace have less access to consistent and quality health care. I also want to draw attention to the tendency of powerful local business, chambers of commerce, and the like to advocate against living wages, workers' rights boards, and other community government collaborations that can really make workers' rights real at the local level, pushing a narrative that too much dignity for workers, like enforceable worker protections, hurts their bottom line and in turn our economy. This is how, according to Jesus Guzman's report, median household income actually decreased in Sonoma County when considering inflation between 2005 and 2016. Another challenge is that paid sick leave is really difficult to access, if at all available, to day laborers, domestic workers, and others who don't have employers for whom they work consistently. Another thing is no unemployment insurance. There have been the options and possibilities of, one-time direct aid that has been difficult to access for undocumented folks. We were one of the founding organizations of UndocuFund, and I'll talk a little bit more about that later. Lastly, language justice. People must be able to receive information directly, easily, and accessibly. Immigrants' rights advocates locally have been making demands for years for a much deeper and more comprehensive push by the Sonoma County government. The Tubbs fire taught us a lot of lessons and created opportunities for access to all information about public services, not only in Spanish, but in widely spoken indigenous languages like Chatin and Mixteco. For the most part, the county government's response to these critical needs has been mediocre at best, I'll say. I'd also like to emphasize the disparate impact of poverty on health. We all know this is real and that the working poor in Sonoma County are overwhelmingly Latinx. Next slide, please. So all of these systemic inequities are simply exacerbated during disasters and are the formula for the reality that we're seeing, where Latinx residents are being infected with COVID-19 at something like 900% the rate of white residents of Sonoma County. So some physical health considerations. One reality we must acknowledge, people are being forced to make the choice to work through fatigue or a cough or even more serious symptoms in order to survive economically, to not get tested if asymptomatic, even though a family member is sick because you have to make rent, to prioritize food on the table. But what does working through injury and illness in order to feed your kids, pay your rent, support your family lead to? It most definitely causes a spread in cases in workplaces, in families, and in living environments, and that's what we're seeing. A recent UCLA study highlighted the disproportionate impact of COVID on low-wage essential workers, particularly Latinos, of which the undocumented community composes a large portion. Undocumented low-wage workers have more exposure to COVID as essential workers, less access to healthcare, and less doctor's visits, and therefore a higher likelihood of chronic health conditions. And workers with pre-existing conditions are much more prone to death. Next, generally, low-wage workers who do not have long-term employers, let alone the same employer from one day to the next, are not provided adequate PPE. Social distancing measures are not implemented in the workplace, let alone mask requirements when jobs are indoors or in enclosed spaces where proximity is an issue. There's often transportation in shared vehicles, unsanitary bathrooms, and other workplace conditions that expose workers. The mental health considerations, I'm sure other presenters this week have touched on. And so I want to posit to you how much work we have to do to center the mental health of essential workers, of undocumented immigrants, of people of color, and those living hand to mouth every day. Threats of eviction, of deportation, a lack of paid sick time, the prospect of a return to a shelter in place, and indefinite unemployment without benefits all has a massive effect on people's mental health. I would say that mental health services for low-wage, undocumented workers is a highly undervalued issue. I see it every day at the Labor Center. I know we don't all have the same levels of privilege in this room, but undocumented folks cleaning our bathrooms, digging ditches, picking grapes, demolishing homes, whatever it may be, have next to none of the privileges that we have. So whatever our levels of emotional distress right now, for day laborers and domestic workers and other undocumented low-wage immigrants, their emotional issues are likely tenfold. So yeah, I want to give Fernando the floor now so that he can share a little bit about CRLA's programs and the specific protections that they're connecting immigrant workers to during the pandemic. Next slide, please.
Gracias, Gabriel. And I'm certain by now that we're all familiar with the term essential worker, but I wanted to highlight that the word essential, as defined by Webster, is defined as something or someone that is basic, indispensable, and necessary. We see here the list of industries that have been granted the honor of carrying that label since COVID-19 made its arrival. And I asked the open question of who's not essential. These folks have been out there since day one working, and as Gabriel mentioned, and they're still working and getting ill. I would argue that we are all essential as contributors to this society, but given the limited time on this presentation, I will focus on a few examples of predefined essential workers, including, next slide, please. Our dear, wonderful farm workers. They are indeed essential. They are absolutely of the utmost importance and basic, indispensable, necessary to us all. The chart here, although I understand it's small, it's hard to read, comes from the governor, actually, Governor Newsom. And I like it as a visual because all you need to know here is that this is a list of essential worker occupations, trades, and to which race or ethnicity they represent. The green portion on your screen represents the percentage of Latinx workers on each of those trades. The top line being our farm workers, and comprising close to 90%, if not more, I would argue, of our farm work labor, which should not surprise you. But this is followed also by the next line, which includes similar percentages for our construction laborers, cooks, food preparation workers, among others that Gabriel mentioned as well. Regarding farm workers, we simply are unable to put food on the table, fresh food that is, that allows us to work from home. From the lucky ones that have the luxury, including myself, Gabriel, and perhaps you, and those who don't equally. Keeping this in mind, I wanted to briefly provide you with some guidelines of what these essential workers are legally entitled to from their employers. Leading me to the next slide, please. So in the state of California, at minimum, employers of agricultural workers must provide them with safe and sanitary working conditions. Among others, employers must provide accessible hand washing stations, clean and accessible bathrooms, and protective equipment at no cost to that employee. Agricultural employers must also take steps to reduce risks related to COVID-19. Employers are required just not to develop this, but to share it and train the employees on the detailed plan that is developed to protect those employees from all hazards, including COVID-19 hazards. Employers should also allow for those steps to protect them to actually be in place, to make sure that the crew leaders, managers encourage folks to follow this and to protect themselves and by extension their co-workers and their families. All employers are also required, as Gabriel mentioned, to provide a minimum 3 days of sick time to their employees. And since COVID-19, especially for those trades in, for farm workers, other food industry workers, restaurant workers, folks that work in supermarkets, they may be entitled to additional time as mandated by law, up to 80 hours of sick time in case they become ill or in case their spouse or a family member at home becomes ill and they need to care for them. Next slide, please. But what about those who are out of work, maybe looking to return to the workplace? What should they be looking for as a guidance to the rules and what the workplace needs to provide them to return and that being safe? I offer you here a link to a web page from the Department of Public Health. And being that we have limited time today, I would focus on the 5 things that are listed here as a base of what must be in place prior to the employee returning to work. To kind of summarize it, employers need to perform a detailed risk assessment and create a protection plan. They need to train the employees on how to care for each other by limiting the spread of the virus and also staying home when ill. Employers also need to develop measures and screenings to make sure these measures are effective. And they need to make sure conditions are sanitary and establish guidelines on how to maintain proper physical distancing also at the workplace. We're sharing these links at the end of the presentation or in the chat, and it also be posted on the website for the forum for future reference if you would like to take a peek. Next slide, please. So once you actually click on this site and you go onto the site, there's two important things that I'd like you to know that are living there. One is a specific guidance depending on trade. Here I'm focusing on one particular scenario, but there's a long list that you can go through. And you will need to locate the trade that is applicable to you and follow those guidelines. The site, however, also offers, and that will be on the next slide, please. It also offers a very helpful checklist for those employers, employees, and really the employers, focus on those employers to make certain that they're ready for reopening in a safe manner. Here you see an example of what the agriculture and livestock employer could use as a good checklist to comply with regulations applicable to their trade. Next slide, please. And then the question becomes, are minority groups who by a significant percentage do work as essential workers, as mentioned before, are they at a disadvantage from the get-go? I offer you this, according to the CDC, Center for Disease Control. The answer is yes, and they offer the following factors, which by itself could be an entire seminar, but I just wanted to highlight these factors as perhaps the somewhat obvious reasoning behind the increase of cases we have seen in the Latinx community. Just the mere fact of being an essential worker puts you in the front lines. Those nurses, doctors, food industry workers, and many others mentioned, these folks, especially those on low pay work, may also have or live in subpar living conditions, overcrowded conditions. Their income, education, or sometimes lack of formal education may of course put them at a higher risk, and they may not get access to very important information as well. Their health, of course, and lack of access to care contributes to their increased risk, just displaying all racism and built-in systemic inequalities multiply their risks exponentially. Next slide, please. This slide, I believe, speaks for itself. The word essential and the definition I provided you does not include the word disposable. And yet we see all these headlines, which took me about 5 minutes to collect. And they continue to increase as time go by. We can see here headlines from farm workers, which the governor admitted just about a week ago how much more needs to be done to protect them. Nurses and other healthcare workers on the front lines, restaurant workers, fast food restaurants, for what I see here, even folks at a different county that work at a clerk office being affected. So much more needs to be done to protect these folks. And let's go on to the next slide, please. maybe an extra click, Daisy, please. Thank you. So why is it that immigrants workers have an additional level of challenges during these difficult times? We have cultural barriers, which again, big topic, but it includes the need to work to survive, to provide for your family. For immigrants, part of the culture is to work and work hard, no matter what. Some folks may even try to demonize immigrants as lazy and only here to self-benefit, but you and I know that that is not the case. And if anything, is the complete opposite. This, along with their language barriers, at least while they get going on this country and figure out ways to go around those challenges, it unfortunately leads to difficulties in, as listed here, securing work, difficulties raising their children and helping them succeed in school. The challenge of learning the language itself is a huge issue, and their lack of knowledge of those services that are available to them, or how to access those services as well. These challenges are particularly difficult and provide the greatest challenge to our indigenous communities, on top of all the unfortunate discrimination that they are subject to on a daily basis. Next slide, please. And here I'll give you my opinion. I believe our undocumented folks are both heroes and survivors at the same time. They have been systematically excluded from any and all federal aid relief programs since COVID came to town some 4 months ago now, to the point of exclusion for mixed families. This is families who file their taxes as citizens and may also have a filing partner who is undocumented. These folks did not get those $1,200 and change, $500 per child in your home, as maybe you and I received. In addition to this, the aid that has been offered by the state of California to these folks, although it was a great gesture, it unfortunately provided relief to a limited number of households. And I'm making reference to the aid that was up to $500 per adult, up to $1,000 per household. So these undocumented folks have a high propensity also for abuse, including wage theft, which Gabriel is going to mention in a little while as well. And although there are new help programs that try to care for that need, there are still some undocumented individuals that simply don't have access to health insurance still to this date, which leads us to the next slide, please. And this is again a complex term here of rural health equity. It would allow for a deep discussion on it here, and I would just quote the American Bar Association here, and I quote, rural residents are more likely and on average to live in poverty and to lack formal education. These interrelated social determinants are known contributors to sickness through a complicated pathway of poor healthcare access, health behaviors, and exposure to toxic levels of stress. We'll post the link to this information as well, if not now at the end of the meeting. And basically the lack of rural health equity, it leads to what we're seeing today in our community. This include health outcomes that may increase already high levels of stress, both physical and mental issues, like Gabriel mentioned as well, that come along with that stress. And these social determinants of health, which include the lack of loss of employment, which also leads to all kinds of housing issues, including the inability to pay rent, unfortunately leading to evictions and homelessness. These issues need to be addressed in order to help assure better health outcomes as well. And we invite those health professionals maybe in the audience to be aware of these issues. I'm sure you are already, but feel free to contact us or refer folks to us as needed. And yes, I also believe we are in for an avalanche of evictions in our future unless actions may be taken to prevent that in the near future. Next slide, please. So what are we doing about it? What is CRLA doing about this? We're trying to address some of these challenges, difficult challenges. We have developed and continue to develop tools for our community members to use in their defense when it comes to housing, and also to educate the community on what solutions and protections presently exist to prevent evictions and homelessness. And very quickly, you should know that as of today, there should be no evictions, lawful evictions, that is, taking place in our county or California, really. There is a local ordinance to protect renters in Sonoma County that have been affected by COVID-19, and there are also court or judicial processes that are not taking place right now to prevent evictions. However, this may not last forever, and this could change in the near future. Do you need to be an expert on this stuff? No, but I ask you to please become somewhat informed of the basics so that you can help your clients, your friends, your colleagues by referring them to folks that may better guide them during their time of need. For that, I offer you our CRLA COVID-19 website link on this slide, which we'll be sharing in a moment, seen at the bottom, which has much more information about housing rights, but also contains some info on the next slide, please. Employment. We continue to provide information for folks to get an idea of which benefits they may be entitled to if affected by COVID-19. Here you can see a sample of those tools, including a guide on the left. It's available in both English and Spanish. But I would also ask that you please keep the right-hand side flyer near you. We'll share a copy, as you may be assisting folks that are facing employment issues related to COVID-19 and may not know which program to apply for. How many days, how many hours of sick time may be available to me, or maybe they just want to know their rights as an employee as it relates to COVID-19. Folks can call that toll-free number. I'm not sure if somebody's attending by phone, but it's 800-357-9513. And of course, this is a free and entirely confidential service to anyone, any community member that calls in any language. We'll make sure to get somebody in your preferred language to assist you. Next slide, please. And last but not least, at CRLA, we believe in the importance of not just helping folks, but educating our community members so that they can too become good advocates for themselves and others by knowing their rights. Here I offer you some examples of flyers. These are also available in multiple languages that talk about their education rights on the right-hand side of parents, which is a hot topic right now. What are my rights as a parent or my child who attends? We have also produced all kinds of information in regards to farm worker rights, videos in multiple languages. There's a lot of resources available to the community. And again, I invite you to that link at the bottom, crla.org/COVID-19. And at this point, I would like to turn the mic back to Gabriel so that he can inform us on the approaches and solutions that El Centro Laboral de Graton is using to address some of those challenges with members of this community that are dealing with these issues during the pandemic. Gabriel, next slide, please.
Gracias, Fernando. So you can see here our organizing model at Centro Laboral, which is essentially to improve the lives of day laborers and domestic workers while empowering them to fight to raise labor standards. This is rooted in a vision of a world where marginalized people are the vehicles of change. We see our work through a prism with a lot of different angles to improve immigrant workers' lives on many fronts. In tackling the impact of a pandemic on our community, we've been tapping into all of these programs and approaches to chip away at the chronic inequities that are exposing our community exponentially during this crisis. I hopefully have and/or will touch on most of these in this hour, so I won't dive into all of our programs, but I will mention that in addition to all of this work, we've actually also taken on new projects and services as a result of the pandemic and previous disasters. Most noteworthy is the Undocu Fund. We were one of the founding organizations during the Tubbs fire in 2017, where we raised millions for displaced families and families with lost income who were undocumented and did not have access to other avenues of support. We were able to reactivate it and support thousands of individuals and families after the Kincaid fire, and again throughout the pandemic. Composed of largely private donations, these funds are powerful and foster some really radical redistribution of wealth in times of crisis, but they are not sustainable solutions as they're band-aids that don't provide a real safety net of any kind. We've also done prepared food distribution through Sonoma Meals. At the beginning of the pandemic, when virtually all of our members were sheltered in place, we were working with local area restaurants to distribute healthy prepared foods twice a week from the center's parking lot. Essentially on March 16th, our work shifted dramatically as we closed the center and paused our job dispatch program. During these initial months, we really had to pivot and address our members' immediate needs in a new way, connecting them to direct aid and resources. And lastly, I want to mention that we've been doing COVID testing at the center. We're collaborating with the Sonoma County Department of Health Services to host bi-weekly walk-up testing at the Day Labor Center. We've been testing our members as well as community members. Next slide, please. So here's a simple diagram showing how our work at the Day Labor Center is rooted in workers' agency and them stepping into their power to catalyze the change that will ultimately improve their lives. As staff with a different set of skills than our members, we do our best to create conduits for them to apply their knowledge, their intelligence, and their wisdom to a political system that's not created for them to participate in or even to exist in for that matter. This often requires lengthy conversations, trainings, political and power analysis of why and how governments ignore their needs or even criminalize them, and what they want to do to address the inequities they're faced with every day. And believe me, it's an uphill battle and it requires untangling issues that are not so accessible and are quite abstract. And even though our community is transient and more often than not off working or looking for work, we're committed to supporting them in building their own power, telling their own story, and demanding political action to restore their own dignity. And what's most beautiful about the work is that once those spaces are created for them to participate, these folks are also committed to being active agents in the fight for immigrants' rights, for racial equity, and for social justice. Next slide, please. So Fernando touched on wage theft. This is one of the most chronic abuses faced by low-wage undocumented workers, the non-payment of wages, otherwise known as wage theft. Millions of dollars are stolen from workers every day. This ranges from non-payment of overtime if people are working beyond 8 hours in a given day or 40 hours in a given week, meal and rest breaks that they are owed by law. It includes being charged for transportation from an office to a job site, being forced to keep working after clocking out, not being paid what one is owed for their last day or their last week or the last pay period before they leave a particular job, you name it. Wage theft is a phenomenon that many employers have literally built into their business plans. So at the Day Labor Center, we're building up our wage theft program because of the egregiousness with which this practice has become normalized. Wage theft is literally a crime, and we need to see it that way. It's essentially employers taking hard-earned money directly out of their workers' pockets. And it's accompanied by exploitation that takes many forms, from stringing workers along to gaslighting them, threatening retaliation, and many other nasty tactics. I can talk at length about wage theft, but want to pose a question. How does experiencing having your wages stolen impact your mental health as a worker? What kind of messaging are workers receiving when these sorts of crimes are the norm, or when agencies charged with enforcing laws to protect workers actually turn out to have limited resources or minimal enforcement teeth? Our wage theft program is meant to streamline workers with cases to the Day Labor Center. We're beginning to host community clinics at the center where workers can come and share their experiences, get support from trained promotores and promotoras, and case managers or advocates who actually include some of our member leaders, and attempt to get the employer to pay them the outstanding wages that they're due with the support of our team at Centro Laboral. We were also co-hosting a monthly legal clinic for the last couple of years at the Labor Commissioner's Office with Legal Aid at Work, a free legal services agency based in San Francisco, to file wage theft claims in situations where we are unable to facilitate an agreement to pay with the employer. We've been doing outreach at street corners too, in Petaluma, in Fulton, in Guerneville, and in Graton, where day laborers are most vulnerable to theft. And now we're largely transitioning to a digital outreach and case management strategy. So is the pandemic exacerbating cases? We're not entirely sure, but employers have been and are going to continue cutting corners, and the effect of being robbed by your employer now will be greater than ever on low-wage immigrant workers. The same employers that are stealing from their workers are the ones who are not observing COVID health and safety protocol as basic as social distancing measures, providing and requiring usage of masks, and so forth. Additionally, we are hearing about situations where workers who test positive are not getting paid their outstanding wages when they're forced to go into quarantine. So at workers' rights organizations, we've long been using the term wage theft epidemic to describe this practice and how widespread it is, to really capture the gravity of what low-wage workers have been experiencing forever. It's no doubt something that we encourage cities and counties to act on, and local municipalities do actually have the ability to pass ordinances that empower city or county staff to contact employers directly or even take punitive action against violators, such as taking away business licenses and other action that'll incentivize the employer to pay once there's a judgment at the Labor Commissioner's Office. Because believe it or not, it's currently very difficult for workers to collect on judgments. So this is all to say that we have a lot of work to do in improving basic labor rights, like a worker's right to fair pay. Next slide, please. Centro Laboral is one of the lead organizations in a coalition that was formed in March, created to address the chronic inequities that grow exponentially in times of disaster and crisis in Sonoma County. Sonoma County United in Crisis, or SoCo United in Crisis, is composed of labor, immigrant, faith, environmental, and other local organizations and their leaders. The coalition developed a shared platform to address issues of major concern and has employed advocacy and organizing tactics to push for more meaningful protections and policies at the city and county government levels that center the dignity of our marginalized communities. The platform includes demands for worker and tenant protections, health education resources, and protections for immigrants before, during, and after the pandemic and other crises. All of these issues, the entire platform and all of the demands impact our community. We cannot heal to address poverty, exclusion, health inequities, and the like by siloing our work. So when we're talking about labor rights, we're inherently talking about immigrant rights. And when advocating for immigrants' rights, we're talking about the rights of the homeless and the precariously housed. And when we wage a campaign to keep tenants in their homes, this is part and parcel of a movement to provide the working poor and the unemployed with an economic safety net. Lastly, we say immigrant workers' dignity is one and the same as immigrant workers' health, because we're missing the mark on conversations about health equity if we don't acknowledge that our health system will only be as accessible and efficient in serving undocumented communities and the low-wage workforce as our local economies are in valuing and uplifting the humans that compose that workforce in their jobs. So we are demanding paid sick leave for all. We're demanding living wages starting at a $15 minimum wage in all of Sonoma County, including the county's unincorporated areas. We're demanding housing solutions, comprehensive homeless services, no more displacement rooted in this out of sight, out of mind public policy, an extended evictions moratorium, and some form of rent cancellation or rent forgiveness for the thousands of folks impacted by illness, unemployment, or underemployment for the length of this pandemic who are really like accumulating rent debt as we speak. Lastly, we demand at a bare minimum for the immigrant community in Sonoma County to have equal access to information in their native language, to have safety from detention and deportation, true sanctuary where ICE is not welcome anywhere in Sonoma County, including our jail and our courthouse, and a real proactive effort by local government to do everything in its power to provide an economic safety net for undocumented immigrants before, during, and after the pandemic. Next slide, please. So our members have been advocating arduously for the last several months to pass SB 1257, or the Health and Safety for All Act. This is landmark legislation at the California state level that just passed through the Labor Committee in the Assembly and has already passed in the House. Hundreds of domestic workers, including members of ALMAS and the Graton Day Labor Center from throughout the state, have given testimony, have flooded committee hearings via Zoom, and advocated for their rights to fair and safe employment. I can't highlight enough the importance of workers telling their stories, giving testimony to the press, and in committee hearings, etc. UCLA LOSH, the Labor and Occupational Safety and Health Program at UCLA, just published a study this week called Hidden Work, Hidden Pain. It revealed 85% of domestic workers described workplace injuries resulting in chronic back, shoulder, arm, or leg pain. More than half of respondents said they continued to work despite this chronic pain out of financial necessity and fear of losing their job. If this bill does not manage to become law, the victory has already been in how much power and drive domestic workers have built at a time when, if anything, the expectation was that they'd fall deeper into the shadows. Women have literally been giving testimony from quarantine, from the fields after a long day's work picking grapes. If passed, this would be such an important victory in raising the floor of worker health and safety and doing away with the current exclusions of low-wage immigrant and mostly undocumented workers. It would apply to domestic workers and day laborers and would bring them under Cal OSH protections. That's the Occupational Safety and Health branch of the Department of Industrial Relations in the state of California. It would bring them under these protections as employees in private homes. I like to call this a ya basta moment. Enough is enough, domestic workers and day laborers are saying, and it's really beautiful to witness. I invite you all to support this campaign. You can find more information out about it on the California Domestic Workers Coalition website or their Facebook page. We have also been fighting to make permanent wildfire health and safety standards that previously barely had any teeth. For the better part of the last year, temporary standards have been a placeholder. And in the meantime, workers and organizers have been giving testimony at Occupational Safety and Health Standards Board hearings, pushing to lower the AQI level. AQI is Air Quality Index, pushing to lower the AQI level at which employers are responsible to provide N95 masks for voluntary use, as well as lower the AQI at which they would be required to provide masks to all employees, along with training, a fit test, and medical evaluations. For those of you who are familiar with Air Quality Index, the voluntary usage we want to lower from is 150 to 100, and the required usage from 500 to 300. It is currently 500. 300 AQI is very toxic air quality. Yet industry reps are still pushing back because it's not economically or logistically feasible, they say. That should give you a sense of what we're up against. when fighting for workers' health and dignity. Now I'll pass it to Fernando for some final thoughts. Next slide.
Muchas gracias, Gabriel, and ya basta indeed. So what is next for our community? I would like to remain positive and tell you that everything's going to be just fine, but the reality is that things may not be great for a while and may indeed get much worse. We need to prioritize in protecting those folks who are indeed essential to all of us, regardless, as Gabriel mentioned, of whether they make the list of essential workers or not. This includes better protections for our frontline healthcare workers, increased protections and outreach to our precious farm workers, day labor workers as well, and also that thing that you heard so many times, that we are indeed in this together, and how their suffering affects you one way or the other and affects all our families as well. We have provided you here with some minimal guidelines, suggestions, and hopefully inspire you to look for ways to help these folks during this impossible time in any way that you can. This includes the right to be counted during this census, so that we can hopefully finally give these folks the spot they deserve, and our respect and admiration for continuing to help our community against impossible odds. And I'll leave you now with Gabriel with some final thoughts. Next slide, please.
Thanks, Fernando. I'll be quick. We all know that there are competing counter narratives in the public and private spheres around immigrants, around their right to dignified lives, quality healthcare, and protection from health and safety risks on the job, and so on. We'd be remiss to think that in California, immigrants do not live in fear, do not struggle to access basic workplace health and safety protections, or have immense difficulty navigating systems largely inaccessible or under-resourced to protect their rights. Sonoma County's economy has grown and thrived thanks to the labor of immigrants who toil away in enclosed and unhygienic spaces and continue to be exposed to COVID-19 because employers are not taking the lives and health of their immigrant workers seriously. Workers are often getting infected at work, as we've mentioned, and spreading the infection at home and in the community. So in this county where financial hardship is the reality for so many undocumented and low-wage workers, I think we have somewhere around 50,000 working age undocumented residents. Their experience every day is a high cost of living, jobs that are not a living wage. Workers are employed on the basis of when they're needed, which that means that they ebb and flow out of employment due to the nature of our local economies. And racialized poverty is a real thing. This is essentially a formula for high numbers of COVID cases amongst undocumented immigrants and the Latinx community at large, and will only be addressed if and when local government takes bold steps to address the chronic inequities that are loud and clear. Whether they develop the political will to address how racialized the inequities are is really up to us, people who see and interact with the undocumented workforce every day. Elected officials will not act without pressure from doctors, teachers, social workers, other advocates, and most importantly, the workers themselves. So I want to thank you all for your time and your attention. Next slide. Here, if you'd like to reach out to us, please feel free. We'll share our email addresses as well. And I know there are a lot of people doing a lot of good work in the community, and we are open to and welcome partnerships and really strengthening the fabric of the work that we all collectively do here.
Awesome. Thank you so much, Gabriel and Fernando, for this wonderful presentation. It was really, really thorough. and great to hear the perspective from the Centro Laboral de Graton and California Rural Legal Assistance. So we'll jump into Q&A right now. So just so folks know, if you haven't, if this is your first webinar of the series, you can use the Q&A section at the bottom of your screen and submit a question there. Or you can use the raise hand option and ask a question live if you choose. Either one will work. We will start with pulling some of the questions from Q&A and registration. So let's dive in. So we got a question a little bit earlier during the presentation. And this person is asking, what signs / questions can health workers look for or ask to see if patients may need services, given that this population may be scared to ask for help? This could be for either Fernando or Gabriel.
You want me to take a whack at it, Gabriel, to begin with?
Sure.
I'll go ahead and, you know, we all know our traits better than anyone else. I know what I can do to reach out to these folks. Gabriel has his own ways. I have seen via just being in working with other clinics and health centers in the past, ways in which the clinic can gently present the sometimes cards and things that the person can, even if their language is limited, to point at, or to somebody who's having an issue with food, and it's a picture of food. Just to give you an example, so I've seen that approach before. I would say it really depends on how you approach your customers. There's all that HIPAA protection, and there's all kinds of rules that you have to abide, and we do too. So I would just suggest to have a good conversation at the highest level possible in your institution of what that looks like and what works, test it out, see what works, what doesn't. And again, we can always interact with each other. We're available to have that discussion, of course, to let you know what we may see as a viable option. That's my 2 cents. I'm not sure if Gabriel wants to add something to that.
Yeah, I mean, I would just say that it's very context specific. It depends the relationship you have with the individuals that you're working with, right? And I think rapport is so key. And having, you know, if and when you have relationships and are able to build trust with people in offering them services or offering them the opportunity to plug them into services, if and when their physical or mental health is an issue, or when they need their basic needs met, really just not imposing on folks, but telling them and sharing with them that you do have access to resources that you can plug them into, has worked on our end in the context of the Day Labor Center, at least.
Mm-hmm. Definitely. And I like that you mentioned that, Gabriel, about, you know, building rapport with the community, because that is something that we briefly touched on during yesterday's webinar when we're talking about text food, text comida, and how much easier it is to get these resources out just by word of mouth. If you're telling your tia and your cousin and, you know, an abuela over here, it builds that trust, and it's easier for folks to access these resources and feel more comfortable about asking, right? So that's really great that you mentioned that.
I would also add that it's important where the message is coming from. So it's much more easy to receive if it's someone that you trust. So building those trust relationships and knowing who that person that they may really listen to and get that message nice and clear. It's so very important at this point, as always, but more now than ever.
Mm-hmm. No, yeah, definitely. So we have a question from earlier from Rosa. Rosa's asking, has an agricultural or essential worker experienced discrimination because of having COVID? For example, needing to take 2 additional COVID tests and both needing to be negative, or needing to eat their lunch away from workers. Can either of you speak to that?
I would just say the answer is yes, without giving a specific, because we also need to protect folks' confidentiality. But there is a wide range of issues happening right now with farm workers. uh, ranging from just plain and simple, they not knowing what the rules are, or their employers not communicating what the needs are. Um, it's an ongoing issue. There's also some suggestion that conditions may not be ideal. I'll give you a generic example that happened in another area in California of the employer not providing clean and potable water for washing hands and drinking as well, which they need to both be potable water. And again, it's not local, so I can probably mention that in general terms, and things like that. So again, it becomes as the importance of the educational campaign that I was mentioning in the slides. We have all the marketing stuff to give out. Getting to them, it's another story, and we try our best to do so. We encourage and welcome any of you listening to partner with us in getting that information to them, and any questions to that effect, please do contact me or Gabriel, and to see how we can assist each other so that they get the message and they know what the rights are, so that they can raise that hand and make that report to Cal OSHA if it's needed, and just give them that power, empower people so that they can become good advocates themselves, and also maybe they can just not help themselves by the whole crew, and in that way protecting their families as well.
Yeah, definitely. I completely agree. So we'll move on to this other question. This could be for both of you, Fernando and Gabriel. This person is asking, are there any community organizations that offer essential workers / day laborers / undocumented folks with PPE? Like probably any folk, this could probably also be in reference to any folks that you might be, or any organizations that you might be connected to that are also offering these materials.
Gabriel, I'll yield to you if you wish.
I mean, that's a really good question. We all know that there is a shortage of PPE right now. To my knowledge, locally, there's not anyone working on that front. I mean, I think there's some like essential PPE, like N95 masks that employers are responsible for providing in any job situation. So if and when a worker is using a mask of that sort, that would be the employer's responsibility. But no, I mean, that's not something that, to my knowledge, is currently happening, and I guess that I would pose that as an important thing to create at the local level, to be able to kind of find somewhere to warehouse that that sort of PPE for workers.
No, yeah,
definitely. I would add that there's nothing in place per se that specifically is doing this. There's all kinds of folks in the community doing the work that perhaps may need to at some point go to the folks who really need to do this and provide that equipment, and again protect those employees. There's all kinds of local agencies that I know of providing, specifically about masks. A few that come to mind, Corazon, Hillsburg perhaps, maybe La Luz Center. I know Latino service providers locally sometimes have efforts to it, but again, I'm not quite sure it's in a specific source that is constantly being providing that service. It's part of it. It's part of the need to, again, inform the individuals of what their rights are, and some that are borderline on what is required, what is not. But if you ask me, I'll give you my honest answer is, if you are an employer and you depend on the labor of these folks, the least you can do is to, even if it's, let's say, not mandated specifically, you better yourself, your company, your profits, to keep these folks safe, to keep low turnaround on employees, and to keep their families safe, which again benefits us all. So I would again encourage people to keep an eye open for local, you know who they are, the local agencies that have been doing such fantastic work prior to me getting involved with CRLA, and they're still there. They're still working toward the community, and start there, and just keep informed. Keep on social media if you can. Keep in touch with us. Keep in touch with the Labor Day Center, and as they come, again, that information will be provided. With that said, there exists some guidelines that need to be, and I need to be careful. It depends on the trade and what that trade needs to provide to each employee. We have that COVID-19 helpline that I mentioned during the presentation. That's a good place to ask the question of whether what you are receiving is sufficient or what should be the right thing to receive. How can we maybe inform the employer as well of what needs to be done in each particular situation or trade?
And I want to jump in there and just add, we in the outreach we've been doing to street corners, talking to day laborers, we have been distributing sanitizer and fabric masks to folks, because we know that there are those fly-by-night contractors or homeowners who are not assuming any responsibility for their workers' health and safety, and are not providing those basic things, are not even providing folks with access to a bathroom, but they're telling them that there's a Burger King down the street you can go use the bathroom in, although they're working a full 8-hour workday and they're sharing tools. So even if the workers are taking some health and safety precautions, we've been doing our best to get out there to the street corners where the most vulnerable day laborers are, and get them some basic resources.
Definitely. Thank you, Fernando and Gabriel, for speaking to that, and for giving a shout out to some of those organizations that have been doing some of that work, like LSP, Corazon, La Luz. And, you know, given that this is another resource, right? Given that we have, let's say, close to like 100 folks on the webinar, right, earlier. So, you know, folks that are listening, you know, if you're involved with an organization that has the capacity to do this, you know, wink, wink, get on it. So let's see, we have time for one more question. For those, just before I ask it, for those folks that did submit some questions and we're not going to be able to get to them, I will forward these to Fernando and Gabriel, and they can answer them and get back to me on their own time, and we will post them on our website when we get a chance. So the last question we have from Lauren, Dr. Morimoto. Hey, she's asking, in your opinion, how could SSU's Wine Business Institute, with its connection to many local wineries, help address issues of inequity with the day labor or undocumented labor population? Or do you think that the Wine Business Institute would be useless, or it's not an appropriate way to connect? This probably a little bit more towards Gabriel's line of work.
So I'll be honest with you, I'm not very familiar with the Wine Business Institute's work, but I know that the wine industry in Sonoma County is immensely powerful, right? And the Wine Growers Association and other industry groups there's a lot of possibility to engage in meaningful dialogue and to really defer to organizations like our own in helping determine what a more worker-centered public policy can look like. And you know, there are particular groups and spaces that are being fostered by the county. Particularly right now, there's kind of like a workforce development working group in which we are participating as the Day Labor Center, and so are industry folks. And I think that's an important, meaningful entry point to have some dialogue. But I think they really need to, I mean, the SSU's Wine Business Institute could potentially be in a position to foster conversation with industry and with community and workers in order to start talking about what do meaningful health and safety and other labor standards look like in terms of really raising the floor and improving the quality of life of the workers that are sustaining that industry.
Mm-hmm. Thank you, Gabriel, for that answer. And yeah, hopefully we can see some more action in the future. It would be really exciting work to see what could come out of that collaboration. So again, for folks that didn't get their questions asked, hopefully we will get some of those answers soon from Fernando and Gabriel. For now, I just want to let folks know again that this webinar is being recorded and it will be translated in Spanish, and that will be available within the next week or so. We will send out an announcement and we will put it on our website when that is ready. But for now, I'll pass it over to Elliot to talk a little bit about what's upcoming for the series.
Wow, what a great conversation. Gabriel, Fernando, thank you so much for your time, for your insight, your candor, and thank you so much, for all your hard work and effort on your behalf, the Great Day Labor Center on CRLA. You're doing the people's work, and we're incredibly grateful for all of your advocacy efforts. Keep up the great work. We're here for you if you ever need support. So having said that, I also want to remind everyone who's still on to please don't forget that we have 2 more days of programming for you. Our next day is this coming Monday. And the topic on Monday, or the name of, the topic is calling out systemic racism responsible for the mental health crisis at the border and beyond. And quick description is that this presentation will focus on highlighting the disparities, mental health distress that have worsened at the border for asylum-seeking families, and the systemic racism that has perpetuated the dehumanization of families and children. The workshop will serve as a platform to share the testimonials of those who have been in community with, at the border, and continue to serve from a distance. Our work will also reflect on the disparities that so many are experiencing due to systemic racism. And as guest speakers, we will have Belinda Hernandez Arriaga. She is an LCSW from the University of San Francisco, and also ALAS. And then we'll have Daniela Dominguez, who is a psych, and she's from the University of San Francisco and the Hannah Institute. So we have 2 more wonderful programs and events scheduled and ready for everyone. Thank you so much for participating today. We really appreciate you being with us. We hope you have a great weekend. Thank you once again to our sponsors. Thank you to the board. Thank you to Daisy and to Pam. You guys did another fantastic job today, and we will talk to you soon. Thank you. Bye.